Due to residual treponema, there is hypersensitivity, and deep dusky red papules and nodules are seen. Now in tertiary syphilis, there will also be cardiovascular abnormalities like aortic aneurysms. This is an aortic aneurysm. Central nervous system features like neurosyphilis. There will be neurosyphilis. You have to remember this. General paresis of insane, GPI. This is the psychiatric abnormality in syphilis. General paresis of insane. The person will go insane and there will be general paresis of insane, neurosyphilis. Tertiary syphilis will also affect the bone, the lymph nodes. So what are you going to remember in tertiary syphilis? See, this is the tertiary syphilis. You may take a screenshot. Tertiary syphilis, you will remember the gammas, the cardiovascular abnormalities, the central nervous system features, and that it will affect the lymph nodes, the bone. And this is the hypersensitivity reaction with punched out edges, and it is going to occur after 20 to 30 years. Let's go to congenital syphilis. So congenital syphilis or prenatal syphilis, when the mother is suffering from syphilis and gives birth to a child, the child suffers from congenital syphilis. The types are early congenital and late congenital. Early congenital occurs in a child less than 2 years of age, and late congenital more than 2 years of age. Now you may get confused in this congenital classification and the latent syphilis classification, so I would suggest you just remember this two. At every place you remember 2 years. So here also you say that early latent is 2 years and late latent after 2 years. Early latent below in less than 2 years, and late latent after 2 years of infection. But here it is occurring in child, the congenital syphilis. So in less than 2 years of age, and it is occurring in more than 2 years of age. Now in early congenital, you know, the newborns, they have very common complaint of rhinitis. So you may think that in congenital syphilis there will also be rhinitis, there will be nasal snuffles, rhinitis, and these are very infective. And the second thing that I told you in while teaching you secondary syphilis, that the bulla and vesicles are seen here. See, in the secondary syphilis was a great imitator. It is a great imitator, but vesicobullous lesions are never seen. And these vesicobullous lesions are seen in early congenital syphilis. See here, in early congenital syphilis, we are having bulla and vesicles. Now let's go to late congenital syphilis. This occurs after 2 years of age, and this is not infective. Early congenital, this rhinitis was causing very infections to others also, so it's very infective. But this late congenital stage is not infective. You will have stigmata like cranial bossing, flat nose, and then you'll see the Hutchinson's triad. Hutchinson's triad, you may get this question, write about Hutchinson's triad. So whenever you see Hutchinson's triad, first of all write Hutchinson's teeth. What are Hutchinson's teeth? These are peg-shaped, barrel-shaped central upper incisor. You see these upper incisors? These are peg-shaped upper incisors, and the mulberry molar. Mulberry, see, so many divisions of this molar. This appears like a mulberry. So mulberry molar and peg-shaped, barrel-shaped central incisor. And see, when you will write Hutchinson's teeth, so teeth sound like E, na? There are 2 E's in it. So 2 E's will tell you about that you have to write about ear and also about eye. So writing about ear, there will be 8th nerve deafness. The vestibulocochlear nerve will get damaged, or there will be 8th nerve deafness. And in eye, there will be interstitial keratitis. Interstitial keratitis, 8th nerve deafness, and Hutchinson's triad. Hutchinson's teeth, when you write teeth, you say E and E and E. 2 E's there. Now let's go to investigations. What all investigations are you going to perform? First of all, do dark ground microscopy. In dark ground microscopy, the sample is taken from the canker lesion. Canker was seen in primary syphilis. See, for dark ground microscopy, you may take the sample from here, from this, or you may take from condyloma lata from here. See, You may take the sample from canker lesions, from condyloma lata, even from the lymph nodes. And what are you going to see? This treponema pallidum. This is a spirochete, and this is a slender, wavy spiral. This is spiral and wavy, fluorescent organism. This is treponema. Now let's go to the serological tests. The serological tests, what all you can perform. There are some specific treponemal tests and some non-treponemal tests. Specific treponemal test, you may remember, like TPHA, TPPA, TPI, TPHA, TPPA, TPI, and ELISA, or you may say it EIA. Both are the same, ELISA and EIA. And then you may say FTA, ABS, and latex agglutination tests. So what are you going to say? You will say TPHA, TPPA, TPI, then ELISA. You write ELISA everywhere, na? ELISA, latex agglutination test. You write it everywhere. So TPPA, TPA, TPHA, TPPA, TPI, ELISA, and the most important, don't forget it, FTA, ABS. And what are you going to remember here? Here you may remember VDRL, RPR, and you may also remember this trust. It's easy to remember, trust and rapid. Trust and rapid, at least you remember these, the rapid and the trust. Just remember VDRL, RPR, trust and rapid. And the Wassermann test, the UST, you may remember. Now see the most specific test. Specific means that once you see this finding, you are 100% sure that it's syphilis. Now the most specific will obviously be the dark ground illumination. You are seeking that treponema directly under the microscope, so it is the most specific test. And the most specific blood test, if someone asks you most specific blood test, so write TPHA, TPHA or FTA-ABS. There are two important here, TPHA, FTA-ABS. Write TPHA and FTA-ABS. What is the earliest? See, the earliest serology to become positive, it must be some immunoglobulin. And you know, the first immunoglobulin to rise after an infection is IgM. So you may do this captcha immunoassay and the IgM will be raised. And the second thing, FTA-ABS. This is fluorescent treponemal antibody absorption test. Now the most sensitive test, again, first of all you will say IgM, then you will say FTA-ABS, because it's going to give you positives, negatives, a lot of positives. So it's the most sensitive. Then let's go to the screening. For screening you will do VDRL, RPR, and for field-based screening you may do the RPR card. Investigations of choice. For primary syphilis, dark ground illumination. For secondary syphilis, FTA-ABS. For tertiary, ELISA. And if there is neurosyphilis, you go for CSF examination. To monitor treatment and disease activity, do VDRL. See, if there is primary syphilis, there will be canker, there will be hard canker, the Hunterian canker. So you will do dark ground illumination. You will see them, the treponema pallidum, which are wavy, which are spiral. See the spiral, the wavy, the slender, fluorescent organism seen, treponema. Alright. And for secondary syphilis, what are you going to do? For secondary syphilis, you will do FTA-ABS. See, this FTA-ABS has come a lot of times. So remember this FTA-ABS. FTA-ABS. For secondary syphilis, FTA-ABS. And for tertiary, in tertiary syphilis, you remember the tertiary syphilis, there were gamma and there were these cardiovascular and the central nervous system abnormalities. Even the bone and lymph nodes were getting affected. See, general paralysis of insane. So what are you going to do in this type of condition? Whenever you see tertiary syphilis, you are going to do the ELISA, because it has progressed to a very last stage of syphilis, not 20 to 30 years. It's occurring after 20 to 30 years. So here you have to do ELISA, enzyme linked immunosorbent assay. And to monitor treatment and disease activity, these screening tests will help. You may do VDRL. Now what's the treatment? This syphilis is very easy to treat. You just have to give injections of benzathine penicillin. The dose will be 2.4 million international units. million units, and this will be divided into 1.2 mu and 1.2 mu, and 1.2 mu will be given in one buttock and this will be given in another buttock. So this is the treatment and the route is intramuscular. Now see, this treatment will vary for primary, secondary, early latent, late latent and tertiary syphilis. Now I made a little trick here. See, for primary and secondary syphilis and early latent syphilis, see, primary, secondary, you just write this 1 and 2 and put a dot in between. It says 1.2 million units in each buttock. So the total dose will be 2.4 million units. 1.2 in each buttock, single dose for primary, secondary, 1.2 million units in each buttock. Now let's go to late latent. See, early latent, what is early latent? Early latent was till 2 years. I've told you to remember it very easily. There was 1 to 2 years, but we have remembered it 2 years because in congenital syphilis also they have mentioned early congenital, late congenital, and here was 2 2. So here I have made it 1 to 2 years and 1 to 2 years. So just remember 2 2. So for primary and secondary it was this, and for latent, late latent, that means after 1 to 2 years of this infection and the tertiary syphilis, you have to give 7.2 million units. And the trick here is that tertiary syphilis, so you will say 3 doses, 3 and 3. 3 doses of 1.2, 1.2 in each buttock, that means 2.4 million units in one sitting, and then another week you will give the same 2.4, then another week 2.4. So the total dose will be given is 7.2 million units. And for children they are saying 50,000 units per kg intramuscular up to adult dose of 2.4 million units. Now how you are going to remember this? See, the adult dose is 2.4 million units, that means 2,40,000. Now the average weight I have taken is 65 of the adult. This roughly comes out to 37,000 units. Now who is going to remember this 37,000? We medical students hate maths, so nobody is going to remember 37 or even 40,000. They'll remember 50,000. So they must have thought that let's just give them 50,000 units per kg and let's see the reaction of the children, and they must have recovered. So 50,000. Now this is just a trick. This is not to be said in front of professors, or you will get a beating or you will get a scolding for sure. So just remember like this, that it's 50,000 units per kg. And for if there is neurosyphilis was seen in tertiary syphilis. In tertiary syphilis there was neurosyphilis, and there we have seen the general paresis. What have we seen? The general paresis of insane, GPI. We have seen general paresis of insane in tertiary syphilis. So see, if there is neurosyphilis, it has gone to the brain, or if there is congenital syphilis, it has been transferred to the child. So benzathine penicillin is not given. See, this benzathine penicillin, it is given in the buttocks and it is released slowly into the body. It is released slowly so that the Treponema pallidum do not have time to multiply and eventually the patient gets treated. But this benzathine penicillin cannot cross the blood-brain barrier, so it has no use in neurosyphilis and congenital syphilis. So what are you going to give? You will give aqueous crystalline penicillin. See, this aqueous will easily go through this blood-brain barrier. So aqueous crystalline penicillin, it is giving intravenously, IV. And you may also give procaine penicillin and probenecid. This is also helpful. Now let's do a very quick recap of all the syphilis. See, first of all, I have taught you the primary syphilis. There is Hunterian canker or heart canker. The incubation period is 9 to 90 days. And there is lymphadenopathy, bilateral, non-tender, rubbery, shorty lymph nodes. In secondary syphilis, it is called a great imitator, but the vesicobullous lesions are never seen. And you will see this papules, the macules, the hyperpigmented plaques, condyloma lata, moth-eaten alopecia, the mucosal lesions, the lymphadenopathy, And how will you confirm this? Not confirmatory, but you will see these epitrochlear lymphadenopathy because all the lymph nodes are involved. These lymph nodes must be the, at least not last, but in the last they may be getting involved, so they must have thought that epitrochlear lymphadenopathy we'll see in syphilis. See the sailor's handshake. Now let's go to latent syphilis. In latent there are no clinical features, but the serological tests are positive, the early latent, the late latent. And what's relapsing syphilis? That the patient of latent syphilis goes back to the secondary syphilis. What is canker redux and monorecidive? That the patient will have a lesion at the same site of this canker, which was seen in primary syphilis. Now let's go to tertiary syphilis. In tertiary there will be gamma, there will be cardiovascular abnormality, there will be central nervous system abnormalities. You have to remember just three now. Let's just remember these three. You will see gammas. Gamma are seen in tertiary syphilis. Then cardiovascular abnormalities and central nervous system abnormalities. This is due to hypersensitivity, and there are rubbery nodules, there are punched out edges. Punched out edges, remember this punched out edges for gamma. They will ask you punched out edges for gamma. And here you want to remember general paresis of insane. Let's go to congenital syphilis. In congenital syphilis, I have told you to remember early congenital, late congenital. Early is less than 2 years, this is more than 2 years. In early congenital, there will be bulla and vesicles, which were not seen in secondary syphilis. They are seen in early congenital. And the patient will also have rhinitis. In late congenital, at least just remember this Hutchinson's triad. In Hutchinson's triad, Hutchinson's teeth, then EE, because teeth is double E. So one E will be ear, one will be eye. In eye, you will see interstitial keratitis. In ear, you will see eighth nerve deafness. On what's in the teeth? The mulberry molar, the peg-shaped central upper incisor. In investigations, you have to remember this dark ground microscopy. At least remember TPHA and FTA-ABS. Now, when you remember TPHA, your mind must automatically think TPPA, TPI. And remember FTA-ABS. Here you will remember VDRL, RPR. You may also remember this trust and RST. The most specific is DGI. The most specific blood test is FTA, ABS, TPHA. Earliest serology will be IgM, then FTA, ABS mark. For screening, VDRL, RPR. Then this. The investigation of choice. The primary syphilis investigation of choice is dark ground illumination. For secondary syphilis, it's FTA, ABS. For tertiary, it's ELISA, enzyme linked immunosorbent assay. And if neurosyphilis, you have to do the CSF examination. To monitor treatment and disease activity, VDRL. For treatment, you will give benzathine penicillin, 1.2 million units in each buttock. And for latent syphilis, 3 doses, so total will be 7.2 million units. For neurosyphilis and congenital syphilis, benzathine penicillin is not given. You have to give some soluble form, so you will give some aqueous crystalline penicillin, which is given intravenously, or trocaine penicillin plus probenecid. This is all for today, guys. Please don't forget to like, share and subscribe this video, and please post your thoughts in the comment section. Thank you.